So we're reporting today on the last two 24-hour periods, and we'll start with through March 29th. We had a very small number of new cases reported that day, just 16, which brought us up to 900. And then in the last 24 hours, we've had an additional 70 new cases, bringing our total to 970 here in British Columbia. So that's total new cases in the last 48 hours of 86. Of those, 472 are in Vancouver Coastal Health, 323 in the Fraser Health Authority, 67 now on Vancouver Island, 94 in the Interior, and 14 in Northern Health Authority. We have, at the present time, 13 long-term care and assisted living facility outbreaks, all of which are in the Fraser and Vancouver Coastal Health areas. As of today, we have 106 people who are hospitalized with COVID-19, and of those, we have 60 people who are in our critical care ICU and HAU units. I think it's really important to note as well that 48% of our cases have now fully recovered, so 469 people have been released from isolation, including over 70 who were in hospital or ICU over the last few weeks. And I think that's really a testament to the importance of people being in hospital at the right time, being ventilated at the right time if they need it, and recovering from this. And I think that's an incredibly important thing for us to remember. And my hands go off to all of the care teams in our hospitals who are looking after these people. We do have 2 additional deaths, both in the Vancouver Coastal Health region, and I can confirm the coroner's office has confirmed our first death in the community as a result of COVID-19. Due to privacy considerations, however, I will not be releasing the identity of this individual or any further information on this person. I think we've talked a little bit last week. We shared a lot of the numbers, the modeling that we're looking at, the preparedness activities we've put in place here in the province of British Columbia, and we really are in a critical juncture right now in BC. And I've said this before, but the next 2 weeks, we're in our second incubation period. This is the critical time for us, where we'll see if our hospitals, the continuing trickle, or if we're going to see dramatic increases. It's very hard to know right now. But I do think, as I said last week, that things that we were doing are making a difference. We are not through the storm yet. We have not yet reached our peak. We have more people every day who are in hospital and in our intensive care units. So we need to continue to do all we can across government, across our health system, and in our community. Every person needs to do their bit. And I know, and I'm very heartened, that most people are really taking this as seriously as we need and are supporting each other, are keeping their distance, but keeping connected in a virtual way. I want to talk again about the fact that we do have an order that prohibits gatherings of more than 50 people, but 50 is not a number that is to be taken lightly. 50, it was only a number there where we thought it was manageable to have social distancing, to ensure that that physical distancing is there. It doesn't mean that you can have 49 people at a house party. Those are the situations that cause this virus to spread, and it's going to spread to the people who are closest to us. So I need people to understand that small groups inside are a risk. Small groups and large groups outside are still a risk. We need to maintain those physical distances, particularly in the coming weeks, so that we can break those chains of transmission in our communities, in our families. In terms of our provincial readiness as well, we've got some supplies coming in. 19 of our major hospitals are now COVID-19 hospitals. They're primary sites. They're ready for this, and they're working hard to make sure that we can be prepared to care for people who have this disease, but also everybody else who needs our health system right now. On another positive note, for many, a new form of learning is beginning this week in British Columbia, ensuring that not only the children of our healthcare workers, but the most vulnerable children in our communities will continue to have the support they need from our education system. So it is back to school in a virtual way for children in the province now. We want and we need our children to continue to learn and to maintain those important social connections that they get through schooling, even though they're apart. So I encourage parents really to incorporate learning into everyday activities, that you have these opportunities with your children now at home. Things like writing emails or texting or having virtual groups with your friends, using the kitchen or the garden for science experiments, and using the new online resources from our education system to help out. So this is it. This is our watershed these coming weeks. We need to be 100% committed, all of us, to doing our part to flatten that curve no matter how long it takes. And we need to double up our efforts right now, reinforce that this is our week. We need you to continue to do your part, to do our part together while we're staying apart.